You can provide hand therapy in an acute care setting. My name is Huang. I'm an occupational therapist and certified hand therapist, and I love helping therapists develop their clinical skills in hand therapy. So, most OTs think about developing their hand therapy experience or skills or just working with hands in general in a very typical outpatient therapy setting where maybe outpatient being like you work with a surgeon, you're seeing tons of post-surgical cases, but you don't have to start there, and you don't have to only think of hand therapy as in a typical outpatient setting only treating hands, right? You can be a hand therapist in acute care. Actually, I'm going to share with you a story. My experience, I had a lot of experience in acute care prior to going into an outpatient therapy setting. And when I was a student, I went and did some burns, and I actually was at a burn clinic in Charlotte. Is it Charlotte? At University of North Carolina. And I was at that burn unit. I met the certified hand, she was an OT-CHT, and she worked in burns and acute care. So, there is a lot of hand therapy that you can provide in an acute care setting. I've worked in both big hospitals and small hospitals, and your opportunity of working with people with hand and arm injuries are greater in a bigger hospital setting. So I worked for a 500 bed plus hospital, and I also worked for a 150 bed hospital. So in the 150 bed hospital, you're going to see a lot more general stuff. You're going to see general decline in function, general like accidents, hip surgeries, a few strokes, but it's just small. So your volume is small, right? You work in a big hospital, 500 bed plus hospital, you're going to see just about anything and everything in an acute care setting. So how do you become the hand therapist in an acute care setting? It's all about, I think, how you're willing to open your mind to seeing how you could do it, because every patient that you work with has two hands and two arms, right? So let's face it, in the world, right? So we go to school and we're taught like holistic, and we treat the whole person. But in the real world, let's face it, OTs get divided into upper body and PTs do lower body. That's how it is, and regardless of what it is and whether you like it or not, like, let's work with it, because I'm not trying to change all of that. I'm just trying to help you open your mind to see like what is possible in an acute care setting, because we can gain our experience in any setting, and it's just how you are willing to see it, right? So in acute care, like I said, OTs get pigeonholed to working with upper extremity, and PTs get pigeonholed to working with the lower extremity. And so in acute care, you can get a lot of upper extremity cases. So let's break that down and see how that looks. Ooh, I left my pen open. So in acute care, what are you going to see? Oh my God, I saw open heart surgeries. I saw abdominal surgeries. I saw strokes, brain surgery, right? We're talking about craniotomies, we're talking about tumors, we're talking about hemiplegia, we're talking about spinal cord injuries. So you can have a certain amount of neurological disorders, and then you can also have like general disorders, and then of course you have your orthopedics, right? The thing with acute care is that you see them at the very, very beginning of their injury. So if you think about a timeline of an injury, right? You think about a timeline of an injury, in acute care, you see them over here. You see them right when they fell, you see them right when they had a motorcycle accident. I worked with somebody who fell in his home, broke both of his humerus, walking around like this. Like, what are you allowed to do with somebody like that? I'll give you some examples of what I did. I worked with people who who had surgery, like routine rotator cuff. Back then they used to like hold you in the hospital longer. Now they're just like in and out. It's all outpatient center, but there's some people who need to stay, and those people might have more traumatic types of injuries, or they may have not responded to the surgery very well, and so they're there because of other compounding types of conditions that make them have to stay in an acute care in the hospital setting a little bit longer. But my point being is that you get a chance to see a lot of people at the beginning phases of their injury, right? And you're still working with people with hand and arm problems, right? And you don't have to just be like, oh, I'm a hand therapist in an outpatient setting. This is an outpatient setting. So they're either over here after a major accident, major injury, or they skipped the whole hospital part and they were just outpatient. Outpatient surgeries, they got to go home. There was nothing crazy major about it. My point being is, you don't have to limit yourself. You don't have to limit yourself in terms of, hey, I'm an occupational therapist and I have an interest in hand therapy. Hey, I'm a physical therapist and I have an interest in hand therapy. You just have to go into these settings, raise your hands and say, hey, I'm really interested in X, Y, and Z. Any of those cases, I'd love to be able to, treat those cases, right? So we used to divide up the floors, because in a 500-bed hospital, when I started, it was just myself and my supervisor. Now most hospitals are growing and they have like a lot more therapists per providing the therapy per however many hospital beds that they have. But you are going to be working with people who have strokes, right? They have hand and arm injuries. One of the things that you could do with them that I think is really important is talk about positioning, show them positioning, and you can show them how to do that stuff so they can prevent hand problems. That is still considered hand therapy. You can show them how they can manually do their movements on their own, right? So that is also considered hand therapy. If you are working with someone who had a major accident, right, you could be doing a certain amount of wound care with them. You could be doing custom fitted splits with them. I did those things in acute care. That all counts towards being a hand therapist. So I don't want you to discount yourself just because you are coming to them at a very, very beginning part of their journey. I once worked with a guy who had a terrible accident, and you can provide manual treatments to them, right? You can provide manual treatments, knowing how to place your hand in certain positions so that you can protect the joint while you're either doing active motion or passive motion, or you are doing some kind of soft tissue mobilization to get them some relief, to get them more motion. All of those things are possible in an acute care setting. So don't think of hand therapy as only being outpatient. I once worked with someone with a radial palsy, and I was able to make him a very particular splint just to support him in a certain way until he got to outpatient, right? Because I was not making a dynamic splint. I did do it once in acute care, but I was like sweating bullets. I was like, oh my God, this is my first one. I don't know. It wasn't my first one, but I learned in school, like one of my internships, but it was my first one alone. My CI was no longer with me. I graduated. I was a big girl, right? I was a big girl now. So you can learn those skills and you can sharpen your skills in these types of setting, in acute care setting. Sharpen your skills there, because when you're ready and you want to move into an outpatient setting, you have the skills so you can know, hey, I can be successful in this setting. Hey, I can apply and I'll know what I'm doing. So I went from acute care. I was there for about 4 years, and I applied for the outpatient position, and I got it. And when you go into those settings, all of a sudden now you are working with a different patient population. and you're working with them in a different timeline. You might be over here or over here, depending on the setting that you work in, right? In a hospital outpatient setting, they're here and they're coming. Oh, actually, sorry. Let me do it like this, right? So this might be a skilled nursing facility. This is acute care. This is outpatient hands, but this is outpatient hands in the hospital, right? So they might have skipped here, but they might be coming to you here. So those people come, they're more fresh, from their injury, because hospital systems nowadays be trying to keep everybody within their system. So if you work in that setting, you might get them a little bit more fresh as well. But if you develop and work on your skills as a therapist, knowing hand injuries, knowing the anatomy, knowing some manual techniques, it's gonna set you off. It's gonna set you up. It's gonna set you up more knowledgeable, more confident, and you'll be more you'll be more successful faster, right? Most people get hung up because they don't develop any of their skills, and then they go for the job and then they feel like shit because they don't get it, or they feel like shit because they do get it and they're like, oh my God, what am I gonna do now? So you can develop your hand therapy skills in acute care and think more outside of the box, include yourself as the hand expert, as a therapist who can work with hand and arm injuries, no matter if you're in acute care, right? So give yourself that permission, and if you need my help, the links are below. Actually, I was teaching my manual therapy class in California one year, and I had a lot of acute care therapists who had that particular question, and I would think that from which classes would be really, which programs would be really good. I think that from acute care, manual therapy, right? Manual therapy is a really great class. You can either take it live or you can take it on demand. It really doesn't matter because you have the patient population you could be practicing with. Live is good because you get to practice and get the hands-on stuff. On demand, it's great because you get to keep it all and it's all organized in a way that you can always come back to time and time again, and you have lifetime access to it. So yeah, a manual therapy course is really good. If you are in acute care, you have some hand experience and you have the years and hours and you're ready to become a CHT, you can totally take exam on demand or do the live version of the exam on demand to help you move into that exam, move into that CHT realm, and then you can either stay at the setting you're in and be an acute care CHT, depending on what patient population you want to work with, or then go ahead and move into a more outpatient setting. But once you're a CHT, you have the ability to move between settings. Like I said at the beginning of this video, I worked with a lady, and I will always remember her because she was I was the first group to become a certified hand therapist at that time, and she just really loved being a therapist. So you got to meet people who love being a therapist, because I think that can help you with your trajectory in the therapy world. But I met her in a burn unit, and she loved being an OT. She was talking about how different it was when she started and then now being a hand therapist, and how how OT has really changed. But what I saw in her was that she really loved being a therapist, and she loved being a certified hand therapist, and she just loved being able to, kind of be fluid, but providing hand therapy in the acute care setting, in burns, and like in any setting. That's how I felt it from her, that she could be fluid in any setting and still be able to provide a lot of value for the patients that she was working with. So in any setting, it's possible for you to develop your skills in hand therapy. So I hope that helps.